President Obama saying he's willing to meet the Republicans in the middle, but is that possible? Joining us now, Democratic Congresswoman Debbie Wasserman Schultz of Florida. Beautiful, sunny Florida. She joins me live.
Yes, it is.
Good afternoon, Congresswoman.
Hi, Megyn.
Yeah,
thanks, and congratulations on your new show.
Thank you very much. We're feeling very jealous of those in the Sunshine State today. You're very smart down there.
It's in the 60s here.
That's clear. But let me ask you, okay, so you heard John Boehner saying, what's the point? Like, the point is start over, scratch the bill, and then we'll chat. Do you agree that that needs to be the starting point? Get rid of the bills that don't look like they're going to get support in the Senate and the House right now.
No, I don't agree at all. I do think that we need to have a willing partner when it comes to bipartisan compromise. And thus far, I really haven't seen any willingness on the part of the Republican leadership or the Republican conference to be that willing partner. John Boehner needs to understand, like President Obama said at the impromptu press conference in the briefing room yesterday, that negotiation and bipartisanship does not mean I take up your few issues that matter to you, do it your way, and that's compromise. We have to sit down, find the common ground and the overlap, focus on cost containment, focus on making sure that we can expand access to health care and stabilize the costs for the 85% of Americans that have health insurance, and then we might have some hope of coming together. But I think it's important to note that 63% of the American people, despite their frustration over the process that health care reform has taken, Megyn, 63% of the American people still want Congress to find a solution to health care. And the Republicans need to recognize that and come to the table and meet us halfway.
They want something, but I'll tell you, take a look at our latest Fox News Opinion Dynamics poll, which shows that, okay, we asked, okay, well, what do you want? And the numbers came back, and they're pretty stark. 47% say they want you folks to start over. They want you to scrap this bill and just start over. 23% said, all right, work on the current bill. You can pass the current bill. And 23% said, do nothing. Don't do anything to health care reform. So the majority of those folks polled said, start over. Why not just start over? You take your ideas, and the GOP has their ideas, and you find a compromise.
Because we've made a tremendous amount of progress, and the Republicans have said over and over again that they agree with 80% of what's in this bill, and that it's about 20% that we still have yet to find common ground on. Starting over, what the American people don't want to see is us go through the thousands of hours of hearings again. The starting from scratch will put us right back to square one and take us much further away from finally achieving comprehensive health care reform.
But they do
and that
want
isn't
that.
something that the American people want to see.
How do you argue with those poll numbers? I mean, they're saying that they do want you to do that.
There are lots of different polls, Megyn, and I'm not surprised that the Fox News poll would show that that the numbers are at that point.
Now,
but
come on.
It depends what they mean.
We poll just like everybody else polls. There's no conservative or liberal bias in the polling.
Okay, well, 63% of the people just polled in the Washington Post poll showed that they want us to still work towards reform. They're not saying start over. If we start over, we're going to be long past the next election before we reach reform. We have an opportunity with 80% agreement on the bills that are in front of Congress right now. Many of the Republicans' ideas have already been incorporated. But, Megyn, I think what the American people do understand is that so far the Republicans haven't demonstrated that they're interested in compromise at all. They've consistently said that they want the Democrats' agenda and President Obama to not be successful, to fail, because they're focused on the results in the midterm elections. Democrats are focused on balance, making sure that we can bring costs down, making sure we can expand access to health care for the 47 million that don't have it, and for small business owners like a guy who I was online with at the security at the airport the other day, who told me that the premiums for his small business went up 172% last year because of one sick employee. Those are the problems that they want us to tackle, and starting over isn't going to get that done.
You talk about bringing costs down, and you've heard this from your Republican colleagues. One of the big ways that they want to get costs down is tort reform, meaningful tort reform. And they point to this Congressional Budget Office study that said you could bring down the cost of health care by over $50 billion if there were meaningful tort reform, i.e. something along the lines of capping non-economic damages in medical malpractice cases and working to lower premiums for doctors. Is there going to be any reaching out to Republicans when it comes to meaningful tort reform?
Well, if meaningful tort reform equates to caps on damages, no. because caps on damages have been proven over and over in the states that have tried it, mine included, that they don't bring down health insurance premiums. They don't make insurance
one last question
reform.
before I go, because I want to get your answer to this.
Sure.
What about in Texas? One of the things they did that they tout is they required somebody filing a med mal action to produce proof of a doctor's report, an expert report, if you will, supporting their medical malpractice claims within 4 months of filing the complaint. Is that something you could get behind?
Yeah, those kinds of, there is tort reform that is reasonable, that has been proven effective, that are piloted in the states, as President Obama has supported, that we absolutely can find common ground on. But to Republicans, tort reform equals caps on damages, which has been ineffective. We need health insurance reform, and we need to focus on the insurance companies and repeal McCarran-Ferguson so that we can prohibit them from colluding on prices. That'll bring at least a 10% reduction in insurance premiums, and we're going to do that the week we come back.
Got to go. I just can't stand looking at the beautiful trees in the background while I have this in the background of me. So I have to wrap you for that reason alone. Congressman Debbie Wasserman Schultz.
Sorry about that.
Thank you so much for coming on.
Thanks.